everything you will be doing yourself. Okay, I will explain things. We check hearing in your both ears, starting from your right ear. For this, you have to put headphones, okay? And what's going to happen? You will hear a lot of sounds first in your right ear. The point is, as soon as you hear sound, you have to tap on the screen. The headphones will be connected with device. As soon as you hear, you tap. If you're not sure, you wait until you're sure you hear, you tap. If you don't hear, you don't tap, okay? Then make sure the right goes on your right, left on the left. Once the right will be checked, on the screen will appear saying press next to the left, and then the same thing will play in the left ear, okay? Now just you can adjust and put them nicely, make sure that it's covering and not putting too much pressure. It says that sounds will play first in your right. When you press next, it will start to play in 5 seconds. You hear, you tap.
Okay.
You're hearing both ears good.
Good, okay, that's good.
Which means for sure nothing happened to your inner ear. Okay? There's no drop of hearing, what sometimes can happen out of blue with infections, and we do not know most of cases why. Okay? Let's take this as blockage of the middle ear, a little bit of mucus in the left, especially that I can see yellowish, that patch. What I would suggest, you start nasal spray, steroid 1, and you keep going. And this is not only for 1 or 2 weeks. It might take a couple of, the same like asthma. You may need to use this as a course. Once you improve, you can stop. But if you feel that symptoms coming back, you might need to go back on the same thing. Depends how it goes, okay? But usually the steroid nasal spray would be for at least 4 to 6 weeks. We recommend 2 to 3 months, okay? Twice a day, morning, evening. Okay, I do prescription now, you start now, okay? And hopefully all that will, disappear, won't be bothering you much. But and you might rely on the thing.
Take this away, hopefully, the noise.
The way, the pulsatile nose, what usually happens, if you have a little bit of fluid, that sometimes, the sound, different type of noises comes because you hear blood vessels when the pulse comes, that fluid pulsates as well. Okay, and probably depending on the position, more maybe at night, I do not know, maybe. With fluid, it's more linked to the head even position if it's not fully packed with the fluid. And sometimes you even feel when you move your head that it's moving inside. Some people feel, okay? See how it goes. It should go away. Okay, it's not high pitch ringing. That's not constant. It's more like pulsation. Should go away, okay? You can use for 1 week or 3 nasal spray to open up your eustachian tube, okay? But try never to blow your both sides at the same time. You always blow only one side at once, because if you blow hard both sides at the same time, you're pushing mucus. This is how usually things happen.
I didn't know that.
Okay, it's the simple things, but but once you know, and you do 2 puffs each nostril twice a day, morning, evening, every 12 hours. You leave in the bathroom, you will never forget.